Hello, I'm Dr. Manjunath Malige. On the eve of this World Diabetes Day, I would like to talk to you about one of the limiting conditions that happens in some of the patients with diabetes, which can have a strain on one's own personal life as well as one's own relationship with family members, colleagues at work, and friends. Now, this condition is, in medical terms, known as hypoglycemia, which in common man terms means low blood sugar level. I'm sure you would have seen or heard of patients who have diabetes who are on either tablets or insulin for the treatment, and sometimes their blood sugars might go low for various reasons. Now, this is exactly the situation when things can slightly go wrong, and it would be helpful as either friends, family members, or partners that you know how to recognize this particular situation. Let us consider this in a couple of different frameworks. Now, let's first consider diabetes in the elderly age group, senior citizens. If you have a parent, a relative, or a sibling who is in the elderly age group, who is either on tablets or on insulin for diabetes, how to recognize that this patient has low blood sugars? Now, the common symptoms that you need to look for are unusual tiredness, sweating, a feeling of palpitations, which means the heart racing faster, getting angry, blurring of the vision, and irritability. So much so that these people can also get into a fight or an argument very easily. Now, this is what I would like people to understand, that if a person who otherwise has a normal behavior and starts behaving slightly differently and is on medications for diabetes, this could well be the low blood sugar or hypoglycemia. So please, in this situation, check the blood sugar of the patient if you have a glucose meter, and if it is 70 milligrams or less than that, it means the patient is running a low blood sugar. You can quickly give them something sweet to either eat or drink, like a couple of biscuits, a chocolate, or glucose tablets, or a sugary drink, which will bring up the glucose level in a few minutes, and they should be back to normal. If it doesn't do the trick, then obviously you'll have to get the patient to the hospital for further assessment. Now let's consider another framework. Children and children in school. I'm sure you would have seen young children who have type 1 diabetes who unfortunately will have to take either 3 or 4 injections of insulin every day. Now these kids sometimes may not recognize the symptoms of hypoglycemia, and it's important that parents, siblings, family members, and also teachers at school recognize hypoglycemia so that they can appropriately treat the child. If your child starts behaving abnormally, irrationally, or is very tired and withdrawn, please check the blood sugar level. And if it is low, less than 70, treat her as I have mentioned. It is also important that you appraise the teacher of the class or the head teacher in the school about your child's condition, particularly when the child is taking part in physical activities like sports, swimming, etc. The other framework I would like to discuss about is the life partner. If your life partner, husband or wife, is suffering from diabetes, please bear in mind that some of the irrational behaviors, angry outbursts, could well be due to low blood sugars. So, if you tend to have an argument, or if your partner is very angry or is making some irrational judgments, please check the blood sugar. This might just be as simple as a low blood sugar, which might actually solve the problem. And it is important that we do not judge people at this situation and do not run into conclusions. For people who have diabetes and are on treatment and who are working, it is very important that some of your close colleagues at work know about your diabetes condition and the treatment you are taking, and that sometimes you might have low blood sugars, so that if they find this happening, they can help you appropriately. Now, every patient has a different set of symptoms when they have hypoglycemia, and it is worthwhile mentioning these particular symptoms to your colleagues. Like, for example, say, if I were to get angry, if I were to get irritable, if I were to have sudden headache, or if I were to feel very weak, please check the blood sugar and give me something to eat or drink. This really will help you a lot. Okay. And the last situation I would like to talk about is pregnancy. Diabetes can happen in pregnant women, and diabetes patients can get pregnant. So the first one is called gestational diabetes, and the second is pregnancy in diabetes patients. In these situations, again, you need to be particularly careful that the patient does not develop low blood sugars, because it affects both the mother as well as the baby. So hypoglycemia, low blood sugar, less than 70 milligrams per deciliter, please treat the patient. If the symptoms improve, well and good. If doesn't, check the blood sugar in 15 minutes by a glucose meter, and if it's not improving, you need to get the patient to the hospital for further treatment and assessment. Thank you very much.